There is in Washington an organization called Center for Responsive Politics. What that does is track campaign or contributions to candidates for and members of Congress. And for the last 20 years, and you can check this on the website, opensecrets.org, for the last 20 years, out of 100 industries, the healthcare professionals, which means doctors and hospitals, have ranked between second and sixth out of 100 industries. And those industries include coal, insurance, pharmaceuticals, banking, etc. So we may conclude that healthcare professionals have some influence in Congress. Now let me shift gears. In the House bill that was proposed, I think it was, I don't know, the section 1233 or whatever, there were about 3 pages which empowered doctors or would compensate doctors for giving advice to people with incurable diseases, near end of life, as to what their choices were, what the consequences of one form of treatment or another were, what the prospective longevity was after treatment. In other words, so they could make intelligent choices. We all know that there's an enormous amount of money spent near end of life. The cries came from the radical right about death panels. The government's going to get the power to kill my grandfather, my grandmother. And the bill was hooted out of the House by the radical right. I would like to hear some rational explanation of why the medical community, which unquestionably has influence over Congress, did not step up and tell the American people what the truth was, that this was a distortion, that this was of benefit to them. There was not one authoritative voice, nothing reported in the media. I would like to hear you discuss that.
Thank you. Thank you. Does anybody want to take that?
Well, I think the doctor is in the audience. I think he is leveling a comment which I totally agree with. But it wasn't only the physicians. This was the most distorted, despicable twisting of logic that I've ever seen. The irony of it all was these are the same people that say they're protecting Medicare, who are the ones that don't want to fund it, don't want to pay physicians adequate amounts of money. So I personally got blogged against it. I thought I was saying something that was quite reasonable. We, both as patients and as physicians, should get better knowledge on what works and what doesn't work. I don't know about you. I want everything that works. You know, I want to live to 150 if it works. But I don't want to be attacked by things that don't work and make my life miserable. And that's what I said before the Senate Finance Committee. Well, you would have thought I was Satan reincarnated. You know, this guy is for rationing. Get out of here. So I'm totally on your side, sir. And it's unfortunate. That provision came from a good Midwestern, I don't know whether Methodist or Baptist hospital that was actually doing that, paying physicians, paying more for physicians to spend the time with people to educate them on what their options were. This was not some radical, crazy, anti-government proposal. And it got so distorted by this wacko woman in New York.
Doesn't it have a lot to do with who controls the discourse, who controls the conversation in the greater public sphere? Doesn't that have to do with that? The Fox News people, the conservative talk radio. I mean, do they have anything to do with moving this? And I'll throw this out to the three of you. Or is this just...
Well, I think normal journalistic standards don't apply in these kinds of debates anymore. The downside of social media that exists, whether it's blogs or whatever, is that there are no standards that apply. People can say anything. Stories can take a life of their own. And by the time you get around to fighting it, it can be too late. And then this kind of thing happens. And the traditional media, what we would call the respectable traditional media, no longer have the financial resources to cover these stories to the extent they would have in the past. So misstatements, mistruths, lies can go forward, and people are not held accountable. I mean, Newt Gingrich, who jumped on that bandwagon privately for many years, had been arguing for exactly those same kind of provisions for end-of-life advice to patients, because he understood, as a conservative economist kind of person, that made sense. And he just decided it was more politically opportune to go with that line than to stick with what he had believed in. There was nobody in the media who could make the strong case that he was being inconsistent even with himself. So I think that was a sad statement. Bob?
It's sort of difficult to be in this audience and fully respond. As someone who spends a lot of time interviewing people around the country, what it turns out is that in parts of the country, there are people who have very strong religious faith, possibly very different than people here today, who feel that the government should not in any way be involved in decisions encouraging or discouraging end-of-life decisions. And this is not a policy issue to them. I did a lot of research. Who were the people who did not want the tube disconnected from Terri Schiavo, who stood in front of that home? And they were very different than the people I knew. They were people who basically feel that there is in their religious teaching a prohibition to even discuss this type of issue. And in the course of a great debate about health care reform, they got involved and saw this as a threat to their religious faith. And as someone who does a lot of surveys, it's very difficult to have a policy discussion with anyone across the world, regardless of their faith, if they think their faith is being threatened. So this is very difficult. So if somebody advised me, I would have said, take this out of this bill and discuss this independently of that, because many ministers and others out of the context of this bill would have come forth, and I said that this could be structured that our parishioners could live with it. But in parts of the country, they were very, very threatened. And the television media, and so many of us love competition, but one of the things that you learn about competition in media is it encourages sensationalism. No disrespect to anybody, but there are 80 cable channels. So one or two of them are doing incredibly well. And what they do is take every issue and rub it as raw as you can, and their viewership goes up. So in the market world, you should rub it and they should lose their viewership, but they don't. But this has a very difficult religious issue. And my advice to anybody in politics, in a heated discussion, do not enter in the policy discussions that in any way threaten people's religious faith. Get it out at another time. And I think this issue will come back, but it'll be in a context which is less threatening to those people in faith. And I'll just give you an oddity of being in polling. When they tried to impeach President Clinton, and if you're in polling, you interviewed people and it went like this. They said to you, I don't know anybody who wants him impeached. And then you went to another part of the country and they said, you pollsters lie. I don't know anybody who doesn't want this man tarred and feathered. Turns out on this issue, it's the same way. There are parts of the country, the minute you talk about end-of-life decision-making, they say you're offending my church. And there's no other discussion about this. So as we approach this in the future, if as a country that is religiously much more divided than I think we realize, we have to be very sensitive in the context. This was the wrong time to have that discussion. Valid as the issue was, it was just the wrong place to be.